Welcome to Delta Diagnostics Cardiovascular Screening Program. In the next 15 minutes, you will complete important screening tests and have the opportunity to review your results with a cardiovascular nurse who will assist you in understanding the risk of heart disease and stroke as they relate to your screening results and the health assessment questionnaire. This series of tests do not require you to change into a gown or be in a large room with many participants. Our goal is privacy, comfortable setting, and individual attention. So let's begin. When you register for your test with our receptionist, you will receive a folder that contains a questionnaire concerning your health habits, and the staff will instruct you to complete the questionnaire before the testing begins. There are 4 stations that will be visited by you to complete the screening process. The first station will be for weigh-in and blood pressure checks in both arms. The weight report is utilized to calculate the body mass index, or BMI. There is a correlation between a high BMI score and a risk for diabetes and heart disease. Most of the time, the higher BMI score reflects a higher level of fat content around an individual's body or obesity. However, in some cases, even a very muscular, toned individual can have a BMI score outside the normal range. Blood pressure checks are important to detect the incidence of high blood pressure or the effectiveness of blood pressure medication. Checking in both arms is important because changes in blood pressure from right to left arms may reflect important information as it relates to the screening for peripheral vascular disease and the testing for abdominal aorta aneurysm. Station 2 will be the testing area for screening of the carotid arteries and the abdominal aorta. Our technologist, Tim, has been performing ultrasound of the vascular system for 23 years and is a registered sonographer. To begin, Tim will place gel on your neck area for good quality pictures as he moves the transducer around to visualize various structures within the carotid arteries. The screening of the arteries will document if an artery has any buildup of plaque or cholesterol, which may range from tiny spots of plaque to an occlusive blockage of greater than 80%. The testing will also reveal if the arteries are small, tight, and very winding, which is noted to be tortuosity. Finally, and most importantly, the ultrasound will demonstrate if there is thickening of the artery layers, which is a very strong predictor of heart disease. Any pictures that are taken by the technologist are saved and identified as your file. They will be transferred to a server at our office and kept on that server for a period of 7 years. Tim is also responsible for scanning the abdominal aorta to document if there is any sign of an abdominal aneurysm or sac-like swelling in this large artery. Any male who has smoked in his lifetime or used nicotine products is at risk for developing an aneurysm. If the aneurysm is undetected and burst, an individual is in grave danger of dying. The death rate is extremely high for this type of rupture. Again, Tim will put jelly on your abdomen and use the transducer to visualize the abdominal aorta. On your report, there will be information to note the presence of the aneurysm, blood clots in the large artery, or changes to the wall of the artery. These are all important aspects in the diagnosis of cardiovascular disease. Station number 3 is manned by our staff team member, Judy Johnson, who is a registered nurse as well as a registered sonographer who performs echocardiograms for the facilities that Delta Diagnostics services. In the screening programs, Judy's role is to perform the testing to determine if the participant has any signs of decreased blood supply in the lower extremities, which is called peripheral vascular disease. Any indication of peripheral vascular disease is also a strong risk factor for heart disease. Judy will ask you to lie on the table, and she will apply blood pressure cuffs to the arms and legs. Blood pressure readings will be documented, and a formula will be utilized to determine the ankle brachial index. When the testing is completed, you will sit at station number 4 with me, Janice Segure, a registered nurse and director of the screening program. My responsibility is to review your results and risk factor questionnaire and assist you in developing a plan of care. You will be asked for permission to send a copy of the report to the physician of your choice, and you will be given a copy of the results for your personal medical file. This is the time to ask specific questions, and it is the time for me to be very honest about your risk for heart disease and firm about the need to make serious lifestyle changes. I've had the experience in educating patients about changing their risk for heart disease. My motto is to supply information for an individual to make an informed choice. The last step to complete your process is getting copies of your results and completing the evaluation questionnaire. Delta Diagnostics staff wants to know what you think about your screening experience, and your comments and evaluation are greatly appreciated. Cardiovascular screening by Delta Diagnostics is safe, effective, and of high quality. Delta Diagnostics is your local resource for cardiovascular screening. Our commitment does not end when you leave the room, but is the beginning of a relationship with your physician and a resource for your continuum of care. Our quality of service for your quality of life.